Dr. Yana.
Hi.
It's so nice
Very
to
nice
see
meeting
you.
you.
Yeah, great to meet
Will
you.
you please come in?
Thank you.
Just gonna sit down and talk for a minute.
Oh, good. I'm so excited to hear all about Invisalign, and I just kind of want to know how you got started, all that good stuff. So just-
I'm glad to tell you.
Yeah.
Thank you.
So Dr. Yana, tell me what made you get started in dentistry to begin with.
Oh, dentistry, that's an interesting question. I feel like I've always wanted to go somewhere into medicine, and my first job when I came to America, I moved here from Russia. I grew up in Moscow, and my first job was working in a dental office. My uncle is a dentist, and so I came to kind of help him in the beginning, and I thought that dentistry would be a perfect fit for me because I never really wanted to have to deal with people dying on me. That was a tough one for me, but dentistry gave me an ability to be in medical field, but also, you know, do something that's aesthetic and something that's beautiful.
Makes
and
people
so
happy,
it's
you know?
perfect. Yeah, it was perfect for me. And so, since it's interesting, since my first experience in America, since my first work in America job, I started in the dental field, and then it kind of continued.
And so did you fall in love with Invisalign, the process of doing it, or?
You know, I did not learn about Invisalign until I graduated from dental school. So I worked in dentistry for a few years before I started dental school, and I did front office, back office work, kind of learned both. Then I started dental school, and I always worked with cosmetic dentists. And I thought that once I graduate, I'm going to do cosmetic dentistry, and I'm going to do veneers, or, you know, things like that. And so after I graduated, I started working as a general dentist, and Invisalign was just coming about. So Invisalign, I think, started in 1999. I think I was trained in 2001 or 2, so almost right at the beginning. And once I tried it, I fell in love with it, and I thought, oh, this is something that I would love to do. And I got a job working for a high-end celebrity dentist here in Century City, and I already knew how to do Invisalign a little bit, and he had a huge clientele that wanted Invisalign, and I started focusing on it, and at some point it became a full-time job for me. So I stepped away from doing general dentistry and cosmetic dentistry, and I fully focused on Invisalign, and I've been doing Invisalign only probably for the last 15 years, a long time.
Yeah.
Maybe 14, maybe.
Yeah.
To be exact.
That's great though that someone can come to you and you're a specialist in Invisalign. You don't do all kinds of dentistry, so you've really kind of been able to hone your skills more.
Yes, I feel that it's a perfect fit for me, and I feel that once you focus on one thing, then you become good at it. You spend you do all kind of mistakes in the beginning, like everybody else do, but then you perfect your knowledge, and you know, with experience comes great results. And so because I only focus on Invisalign, I take all the courses that they are on Invisalign. I listen to my colleagues speak, people who have as much experience or less experience. Everybody have their own take on how to do it, you know, their own inside information. And so, yeah, you get good at it, and you get great results.
That's great. I mean, let's face it, root canals are very glamorous.
No, root canals are not very glamorous.
They are not at all. So you kind of get to do the more glamorous side of dentistry, and you get to make people feel happy and confident about their smiles.
Exactly. So I think that when I was in dental school, I really started noticing that people would come and say, don't take it personally, but I hate dentists. And I was really offended by it because I'm a very social person, and I think now that I'm in practice for so long, communicating with my patients and creating a relationship with my patients is so important to me. And when people really are hesitant to come in and see me was not a good thing.
Right.
And so that's another partly reason why I focused on Invisalign only, is because Invisalign is not invasive. People look forward to coming here. It's very different than anything else in dentistry that's out there. And so I focus also on smile as a whole, rather than doing, you know, a little bit of filling here and a little bit of crown there and the root canal there. So I create a beautiful smile for somebody that brings them joy and makes them smile more, that's also really positive and pleasant for me and hopefully for my patients.
Yeah, I mean, and walking into your office isn't terrible. I mean,
Exactly.
You have the penthouse, you have a sweeping view of, I think, like all of Los Angeles, Beverly Hills, I can see downtown. It's so beautiful and so glamorous that you're able to offer your patients like such a great setting to come to.
This is by choice.
Yeah.
I feel that I am inspired to change the way dentistry is viewed.
Yeah.
And I wanted to create like a patient-centered, people-centered practice where people will feel comfortable and people will enjoy coming here and hang here and maybe interact with one another and with me. And so this is a great setup for me. I call this an Invisalign because it does not look like a dental office, and it's not very practical because normally you would see a few operators in a small reception room, but for me this works and this is the perfect setup and get the feel for how I do things and what I do with my patients.
I love the way you do things. They're right up my alley. I love the sparkle. I love the faux fur throw. I mean, as soon as I walked in, I was like, wow, she's definitely paying attention to all the details, and that definitely sets you apart from other dentists. So
great, thank you. I'm trying.
Yeah, you're doing great. And I've always wanted to have straight teeth and to have a straight smile that I could feel confident about. And you know, for years I felt like, okay, it's not that big of a deal in pictures. No one can really see my teeth. I just smile and no one knows that they bother me. But then when I started doing YouTube, I would watch the videos and I was like, gosh, my teeth do bother me. And now that I'm seeing these videos, now I get to see how people see me when they talk to me. And so it makes me a little self-conscious. I'm so excited to be able to.
I am excited to be able to help you get the smile that you always wanted. You really have an amazing smile, but you're right. Sometimes it's interesting how sometimes you tell people that, oh, they have a little crowding on the bottom teeth, and people say, oh, but you can't see it. I'm like, no. Take a mirror and try and talking to yourself, and then you can see the bottom teeth really show. For some people they do, for some people they don't. But in the pictures we normally just see the top teeth as, you know, in our beautiful smiles. But yeah, when you speak, you start seeing lower teeth. And so ideally, I also always tell my patients that it's not just the aesthetics a lot of times. Yes, and people say that Invisalign is for improving smiles and making them beautiful, but also, you know, having crooked teeth, even if you don't show them, you know, there is a health aspect to it. And being able to floss, being able to clean them, you know, straightened teeth create better, healthier mouths too. So you can look at Invisalign or straightening your teeth as both perfecting it in terms of aesthetics, but also looking out for your health.
Okay, so for Invisalign, do I have to wear a retainer, or how do the trays work?
So Invisalign is a full-time process. So you get your aligners and you have to wear them full-time. You wear them day and night. You take time to eat, to brush your teeth, and to drink anything except for water. And the rest of the time you have them on. After you're done with the process, you're going to get retainers that you have to wear only to sleep indefinitely.
Okay.
It's kind of a crazy concept to commit to wearing something in your teeth for the rest of your life, but teeth are moving throughout your life. So whether you do Invisalign or braces, or you have a perfectly straight smile to begin with, 10 years down the line, the teeth are gonna move.
Right.
That's just how it is. So if you invested all your time and money and effort into getting what you really want,
wear the retainer.
You should wear the retainers and hold them in place.
Right, and so basically everyone should kind of be wearing a retainer.
Everyone should be wearing a retainer. It's a crazy concept, but you know, if you're happy with your smile, the teeth will move. If you're unhappy with your smile and you move the teeth, then you should wear retainers at the end. I would think that about 60% of my practice is somebody who had braces or Invisalign before, and they stopped wearing their retainers at some point, whether the doctor told them or they just stopped wearing them, and now they have to be back in treatment to get the teeth to perfect position again.
Oh man, so the moral of that story is follow the instructions.
Exactly.
Wear
the retainers are your friends.
Yeah, because who wants to pay twice, right?
Exactly.
Just once is good for me.
Exactly.
I will be a good student, I promise.
I believe that.
So how does a dentist go about getting the title of a celebrity dentist? Sounds so glamorous. I love it.
I that there are probably two categories of dentists who are celebrity dentists. One is a dentist who is on TV, and dentist who is like on a talk show, like The Doctors or Extreme Makeover. And so you are a celebrity dentist just because people see you on TV. And another category is somebody who have an extended celebrity clientele. So I see a lot of celebrities, even though I don't really like to talk about it. I feel that it's kind of weird to take pictures with your patients. I feel like patients deserve privacy and other things. But in terms of celebrity dentist who is on TV, I worked on some patients who were a part of Extreme Makeover show, the plastic surgery one. Yes, and it's interesting. The interesting fact is, I think we started with when people used to do plastic surgeries first, and then they would bring them to dental office, and then we would do what we can do with their smiles to improve their smiles. And some people could not be helped in the 3 or 6 weeks that we had to perform what we need to do. And so they started to reverse it. So they started to do the smiles first, and then the plastic surgery, because even if you do all kind of embellishment, all kind of stuff on your hair and your makeup and your plastic surgery, but the smile is not there, you don't get that wow result.
Yeah, that's
and
something
so
that
smile
you
is
see
very
every
important.
day.
Yes, exactly.
Can you tell me some of the common misconceptions about Invisalign?
I feel like one of the biggest ones is people think that Invisalign is the same everywhere. So Invisalign is kind of like a pair of shoes. You get them in Macy's or you get them in Bloomingdale's. It would be the same Nikes.
I see.
But it's different. Invisalign is a really doctor-driven process. So the way it works is, you take impressions of the patient and you send it in with your prescription of how you think Invisalign should, the teeth should move based on, what you discuss with the patient, what your goals and your patient's goals are. But then you get that virtual setup of how the teeth are moving, and you actually physically can adjust it. You can move teeth in a certain way. You can do things in a virtual setup to kind of do the sculpting or the treatment planning. And so a treatment planning here with me might be, or the outcome of the Invisalign treatment here with me will be maybe a little bit different than the outcome of some dentist who's practicing right next door.
I see.
Because it's all kind of doctor-driven.
Right, so different dentists take different approaches.
Dentists take different approaches, and that's why the more experienced dentists get probably better results and more predictable results than somebody who is just starting out and who will maybe do 2 or 3 takes in order to get the patient the smile that they want.
That's great. So this isn't going to hurt at all?
No, people don't say that it hurts. You put the new tray on and it's pressure. You feel the pressure for the first couple of days. So normally you wear your aligners for 2 weeks, and then in 2 weeks you get a brand new set. So you feel the pressure for the first couple days, and then it gets really comfortable, but then in 2 weeks you don't even feel them on your teeth. And you put a new one on and it's a little bit of pressure, and then it gets comfortable. So if you're a good patient and you stick with the program and you wear them as prescribed, as many hours as you need to, then you're ready for the next one, so the next one is not as tight.
I see. Okay.
So and you move it slowly. It's a very easy process. There is some adjustment to it. There is a commitment to it. If you don't wear them because they're removable, it's not going to work. But if you do what you need to do, you wear them, you take them out to lunch, and then you put them back right away, you're going to get an amazing result, and you're going to be done in no time. It's interesting. Patients come to me and say, oh, it's a year treatment. So like, oh my God, a whole year.
Yeah.
And then the next time I talk to them, they're like, we're done? That's it?
Really? That's so
time
great.
flies.
Yeah.
Time flies, and you get used to things, and it does not affect your life in a bad way.
Right.
And so you just get used to the system. And then once you're done, you're so happy.
I know.
Most people will never know you're doing anything.
Right.
That's the beauty of Invisalign is 90% of people will never know you have anything on your teeth.
Yeah.
And that 10% you close girlfriend's gonna say, what? You have what? Or
Right.
you're gonna be taking something during lunch and they say, you doing Invisalign? Really? You're straightening your teeth?
That's great that people can't notice it. I mean, I've heard horror stories about braces, the metal braces, and how people get sores and their mouths bleed, and that sounds a little extreme for me.
Definitely. For me, my book, I feel Invisalign has some limitations, but if you can do Invisalign, I don't know why you would do braces.
Yeah.
Invisalign, in a lot of situations, is even faster than braces, depending on what kind of results you're looking for, what kind of mouth occlusion you have. But yes.
That's so amazing. I have really enjoyed talking with you.
Thank you.
I feel so comfortable about Invisalign, and I'm so excited to get started. Have a perfect, pretty smile.
Perfect. We are on the way.
I know. It's so exciting.
Yes. So let me just go over what Invisalign looks like. So this is exactly what Invisalign aligner looks like.
So lightweight.
It is very thin. It's lightweight. You know, a lot of people are amazed that this actually can move your teeth.
Yeah.
But because it's a very gradual movement, it only moves a little bit at a time. So you go through sequence of trays. So every 2 weeks you put a new tray on, and every aligner moves you just a tiny little bit at a time.
I see.
So this is what they look like on. Maybe a little bit shinier, but once they're in your mouth, people will never be able to tell you have anything on. All right, I think we're done. I have everything that I need to submit your case. I will call you in about a month when your aligners are ready, and then I'll call you in and we'll set up an appointment to start.
Okay.
That's it.
Perfect.
I will see you in about a month.
Thank you so much,
So
Dr.
nice
Yana.
seeing you.
Thanks so much for watching. If you found this video to be helpful, be sure to give it a thumbs up and subscribe to my channel. Also, be sure to check back in just a few weeks for a follow-up Invisalign video. See you guys soon. Bye-bye.